Welcome back to The Best Years. We've been speaking with Helen Grant from the National Council on Aging about doing a benefits checkup for seniors. So you mentioned that your computer program can return a list of up to 2,000 federal programs seniors may qualify for. But also every county, every township, there also may be other programs. Can you also help seniors find out about them?
Yes, we do. We've done extensive research, and many of the programs are age-driven. For example, in some communities you might have to be 60 and over, and some 62 and over. They provide transportation to their senior centers. We also, as far as a health issue, there's people that have very expensive medications. For example, a medication can be $500 a month. And if you're just living off your Social Security and getting $1,200 a month, there is no way you can afford that prescription. So we also check into who the pharmaceutical company is. And with your doctor's permission, we put an application into that pharmaceutical company, and they may give you the prescription for free.
So that can make a huge difference, obviously.
A huge difference, not only financially, but health-wise, because there are a lot of seniors that are not taking their medications.
Now, under the Economic Security Initiative program, the National Council on Aging helps seniors in many areas: public benefits, legal services, jobs, housing, the list goes on. For instance, jobs. How can you help seniors with employment?
We are kind of a one-stop shop where we will refer people out to learn how to update their resume, go into a data bank and learn how to research jobs, take courses to help them bring their computer skills up to date.
And how about in legal services? What kind of services do you provide there?
We will help them make appointments with legal aid so that they can get assistance with bankruptcy, foreclosures, credit card fraud, things of that nature, evictions.
Now, we mentioned that your office is in Lakewood, but anybody from anywhere around the state can call and get help by contacting your office.
Yes, they can.
And you mentioned to me that you're seeing people younger and younger coming in. Tell me more about that.
We are seeing much what they call the young seniors as opposed to the old seniors. And what's happened is they've lost very good jobs due to downsizing. So they've been living on their credit cards and their 401k, and they may no longer have hospitalization. And they face eviction, again, the housing word, and it's very difficult. Sometimes they can't even afford food.
So these are obviously very difficult times for people who are hoping these would be very easy years for them. You mentioned that you do a case study on everyone and create an action plan. How does that work?
Well, first of all, let me say that the benefits checkup is anonymous. We do not ask for Social Security numbers. And when the people come into us, we ask them a whole battery of questions, not only for the benefits checkup, but for the Economic Security Initiative. When they come, we do a case study on each person. We keep track of what they're eligible for, and then we devise an action plan for them. After that, a 3-month period, we follow up to see if they followed that action plan and if they need any further assistance.
So if any of our viewers are having trouble affording their homes, paying their bills, really struggling, what's the first thing you want them to do?
Please call us. We will then get your information and make an appointment to see you.
So there's lots of programs out there that can help.
Lots of programs.
So the important thing is to just take action and get started. Helen Grant from the National Council on Aging, thank you so much for coming on The Best Years today.
Thank you for having me.
You're welcome. Now, if you'd like to learn more about how the National Council on Aging can help you, Go online to ncoa.org and click on Enhancing Economic Security, or for personal assistance, call 732-367-7111. Prescription medications, they're lifesavers for many seniors, but also may be the source of great stress as the cost of medication continues to rise. In today's In the Know segment, we'll talk about programs that are available to make prescription medications more affordable.
No one likes taking medicine, but sometimes it's necessary. Hi, I'm Jane Maloney, Director of the Ocean County Office of Senior Services. If you or your loved one needs a prescription and can't afford it, how will you pay for the medication? The Ocean County Office of Senior Services can help you locate a prescription plan that's right for you. Several options are available through Medicare, such as prescription drug plans and Medicare managed care plans that offer drug coverage. The state of New Jersey offers prescription drug assistance for income-eligible individuals 65 or older or on Social Security disability through the Pharmaceutical Assistance for the Aged and Disabled PAD program and through the Senior Gold program. Most Medicare beneficiaries will need to be enrolled in Medicare Part D, and you can call the Ocean County Office of Senior Services at 732-929-2091 to gather more information. This year, the new annual enrollment period for Part D is October 15th to December 7th. Don't wait to call. What happens if you aren't on Medicare and you don't have a prescription drug plan? There are a number of options, such as the Partnership for Prescription Assistance and discounts from certain pharmacies. The Office of Senior Services will be happy to guide you through this process. Remember, the new annual enrollment period this year for Part D is October 15th through December 7th. But most importantly, don't go without your prescription medication. There are many affordable options available. For In the Know, I'm Jane Maloney.
Coming up on The Best Years, we'll take a stroll through a nature lover's paradise. We'll be right back.